I'm here today with Dr. Dale Forsdyke, who is a senior lecturer in sport injury management at York St. John University. In addition to his academic background, he also has vast practical experience working with injured athletes. He was the head of medical for Women's Super League, the soccer in the UK. He has also worked as a physiotherapist and a physical performance coach for the Football Association, and he is currently the head of science and medicine for the York City Regional Talent Club, which is a women's female sport academy in York. It's great to speak with you today, Dale. Thanks for taking the time to chat with me.
That's okay. Thank you for inviting me, Les.
It would be great if you can talk a little bit more about your background, both academically and in terms of your work as a physiotherapist.
Yeah, so the two have kind of traveled together, really. And my practical or applied part of my persona has really fueled my research agenda. And then that obviously fuels my teaching and the perspectives that I'd like to develop in the students that I work with. So for a number of years, over 10 years, in fact, I've been head of science and medicine at York City RTC. It's the highest level of elite girls academy we have in the UK. And it's my kind of responsibility to strategize and coordinate a team in terms of, well, what's the sports science provision our players get, and how does that help with them developing them as international soccer players? But also from a medical side, it's me that's kind of designed our approach to how do we prevent injuries, and probably more pertinent to our conversation today, well, if a player is injured, how do we work with them? What do we do? What do we avoid? And how do we return these players back to sport when hopefully they're physically, psychologically, technically, and tactically ready to do so?
Yeah. What spurred your own interest in injury?
Yeah, so a number of things. I track it back to my undergraduate degree, which was firstly in physical education. And the first bit of research that you're involved with in a UK university is your dissertation. It's your year 3. And I remember my mum actually, who'd had a shoulder injury, and she was relatively active prior to the shoulder injury. And then, according to her, she mismanaged, not really well coordinated her team around her. And then her activity levels plummeted. And that just led me to think, well, what happens there? Why do people's intentions maybe to returning to sport change following injury? Because, we live in an era now where technologically we're at our most advanced. So our approaches should be as good as they ever have been in terms of returning athletes to sport or activity or exercise, whatever their intentions are. But there's a disconnect there. Yeah. So I'm pretty sure that, physically people will get better. Time says that they will actually heal. And maybe, and this fueled my research agenda a little bit, is maybe there's a psychological explanation or a psychosocial explanation to why people just simply don't return to pre-injury levels of sport, exercise, or physical activity.
Yeah. So maybe you can talk more about the focus of your research, Dale.
Yeah, so it's got 2 prongs to actually. What the first prong is looking at return to sport outcomes, and really trying to address the question of, well, we'll have all of these athletes getting injured. We know that's a problem. We know there's high rates of injuries. We also know that actually return to sport outcomes are probably underwhelming, if we put it politely. And we need to start thinking of things other than physical factors. And that really fueled my interest into trying to research psychosocial factors through conducting a systematic review, which was lucky enough to get published in the British Journal of Sports Medicine, it started highlighting the importance of this concept of, or this construct of, psychological readiness. And so that kind of follows my path down to try and research not just psychological readiness, but the whole concept of readiness, and maybe what are the different dimensions of readiness? You know, how can we understand that? Can we measure that? What impact does it have? The other side of my research is around injury prevention. And again, for years and years, we've been looking at that from a purely physical point of view, despite theory suggesting that psychological factors or personality factors can impact that. We've been doing lots of things like warm-ups, and we've been doing lots of exercises like the Nordic hamstring exercise and things like that. And we're missing off spending equivalent time, or some time maybe, dealing with some of those stress and coping issues that may, you know, make an athlete more predisposed to being injured. And so again, we published a systematic review in the British Journal of Sports Medicine on that, and actually looking at, well, when interventions have been done, what's their real world effectiveness in terms of their efficacy, what we know about compliance to these interventions and their efficiency. And it might be publication bias, but lo and behold, if we can intervene from some of the psychological factors that individuals have, we can reduce the risk of injury.
So if I'm an athlete or coach listening, and you just mentioned that stress or personality may play a role in injury risk, I'm wondering how that's the case. What is it about stress or someone's personality attributes or characteristics that could increase the risk that they get hurt?
Yeah, so there's a theoretical basis for that, and it's all to do with the brain and the amygdala in the brain, in terms of how we perceive and respond to stress within our body. But the Williams and Anderson model from 1998 kind of describes the stress response. So the amount of, you know, sports stress, the amount of non-sport stress, can affect my body psychologically in terms of a narrowed attentional focus, loss of concentration, poor decision making. But there's also a physiological or physical element to that in terms of increased muscle tension. If I've got an increased muscle tension, it may impact my range of motion. It may impact the muscle strength output that I can get from that. And it's for those two reasons together that then may make me more at risk of injury.
Right. So kind of that attentional impact of stress, where maybe you're getting distracted, or you mentioned that you kind of get that tunnel vision, right? You're not taking in peripheral cues, but also the physiological impact of stress on hormones, timing, coordination, muscle function, that then may increase injury risk.
Yeah, and unless I have the correct amount and type of coping skills to be able to mitigate some of that, then I'm going to end up with an increased stress response, and that might be that predisposes me to being injured versus other people.
Yeah. So you mentioned your review of the research that you published in the British Journal of Sport Medicine on some of the interventions or strategies that may help people manage that stress. What are, if we're thinking in terms of injury reduction, what are some psychological or coping strategies, I guess, that athletes could employ to help them manage stress and reduce their injury risk?
Yeah, there was a real variety of them, but the major ones that had the highest efficacy were stress management based, and also the literature, it's published that they're more stress management based. So there's things that range from things like progressive muscle relaxation, to breathing techniques, to creating stress diaries, in terms of to audit that stress and maybe reframe what that stress actually is. Cognitive behavioral therapy kind of appears within the literature as well, although that kind of falls outside my skill set into the more kind of clinical side of psychology. But there were mainly stress management techniques.
Yeah. And
what I do as a practitioner to try and follow that research through to impact is we look at the wellness of our players on a routine basis. So typically, you know, I want to find out about a player's readiness to train or to play. So we get them to fill in a self-report questionnaire where we try to monitor sports stress, but also school stress, for example. So we don't say how stressed you are. We phrase it as how relaxed do you feel today, just so we can get a gauge that actually, is there a pattern that across a season, is there a pattern or spikes in stress that we may be able to use the psychologist that's attached to the RTC to intervene? Or we know, for example, with some of our players, they are going to be facing elevated amounts of life stress, such as exams at school. Yeah. And again, that's an opportunity for our psychologists to maybe intervene and talk about dual career demands and stress management techniques, that sort of thing.
Yeah, so it's an interesting point, I guess, in terms of the impacts of stress on injury risk, because you're suggesting it's not just acute stress in discrete situations, where the athlete, may get on the field of play and they're worried about something specifically, but even things like life stress. And I know in a study that I was involved with some Swedish colleagues, Andreas Iverson and Urban Johnson, we looked at the role of daily hassles, like sort of these chronic stressors, and found that they were a significant predictor of injury in elite football or soccer players in Sweden. And so, maybe there's something about this sort of chronic or cumulative impact of daily challenges that can, I guess, wear the athlete down and increase their risk of injury as well.
And that hints at a couple of things to me, Les, which is, I think within the sport world, we're really focused on athletes in maybe the 2-hour window that they are with us, and kind of that is them. That's their identity, everything they do. And we forget that behind every athlete, there's a 24-hour, 7-day a week human being. And I don't think humans can really separate out, oh, this is just a sports stressor, this is a life stressor. I think there is that accumulated nature to it. Yeah. And part of my role is in sports science. So, we often talk in sports science about loading and the relationship between loading and injury and spikes in physical. When we look at it from a physical point of view, so spikes in physical loading equals injuries. Well, how about we look at loading from a psychological and a physical point of view? And it could be spikes in either of those that can cause injuries.
Yeah, and I think that's a great point. I guess load, if you define it more broadly, is more than just their physical load, but it could be the demands that they're facing in their school and their life. Maybe there's, as you mentioned, athletes are human beings, so maybe part of the load is, well, you just had a fight with a significant other or something like that, and all that can come to bear on their stress levels, their risk of injury. So it sounds like, in your role as a sports scientist, in working with high performance athletes, that you're attuned to or aware of what's happening with athletes beyond just the time they come to you, or that sounds like there's benefit in doing so, right? Having conversations about what's happening in your life outside of when you're coming to the football pitch.
I mean, I don't think you can sit back as a practitioner and go, we take an athlete-centered approach or a holistic approach to developing athletes, unless you take into account, all those different facets that make them unique and individual.
Yeah. So on that point about an athlete-centered approach, before we started our recording, we were talking a little bit about a paper that we're working on with Adam Gledhill and Tom Goom, looking at athlete empowerment, injured athlete empowerment. And so I'm curious, maybe you can elaborate on that notion of what an empowered athlete means in the context of injury recovery.
Yeah, and we probably discussed this at length, didn't we, in terms of trying to nail down a key definition of what that is. And certainly the definition we fell upon was, an empowered athlete has the right amount of self-awareness and the correct expectations that are realistic and clear to take control and ownership of their return to sport process.
Right.
And I really quite like the work by Johnny King, who published an editorial about, well, how can we take a more athlete-centered approach? And he talked about, well, the athlete needs to become the CEO of their own business.
Yeah.
They're the chief operating officer of that process.
Right.
And as such, they need to have hands-on and understand all the different processes, all the different people that they coordinate. And so really that kind of encapsulates what empowerment is.
Yeah.
And
But
obviously we feel that it's really important, for athletes to feel that.
Right. To sort of have the understanding that in many ways that, of course, there's important support systems and kind of external or contextual factors that influence recovery, but it's also, the athlete taking that ownership, I guess, that can be critically important in the quality of their recovery or the kinds of outcomes they experience. Earlier, Dale, you mentioned return to sport outcomes as an interest of yours, and maybe you can speak a little bit more about what you mean by return to sport outcomes, or what specifically those are.
Yeah, so for me, there's various that appear in the literature and various that appear in theory, but the key return to sport outcomes are, is that athlete returning to their pre-injury sport first and foremost, if that's what their intention is. The next stage is, are they returning to their pre-injury sport and also remaining injury free? Mm-hmm. Which is really important because injury does suck, and there's some injuries that really suck more than others. And I don't imagine athletes would want to go through that whole experience again if given the option. So remaining injury free is a critical outcome. And then the kind of the third layer of that is, are they returning to their pre-injury sport to a level of performance at or above where they were prior to injury? Right. So there's a performance element to that as well.
Right. How do you assess or measure the performance part?
Okay, so that's really hard. So within the literature, it's not very well defined, and really it's just taking coaches throwaway opinions. I think that there's room for future research around using key performance indicators from performance analysis, and maybe starting to look at, well, pre-injury across let's say 10, 20, half a season or a season's worth of games. This is what your performance analysis data actually was. Let's have a look at what that's like after you've returned to sport. And we can only really say you've returned to a level of performance when really maybe some of those technical and tactical key performance indicators are equivalent or not. Yeah. The other level of that is things like, have you retained the same status in the team? So have you got your place back in the starting 11? Are you still considered for the next international camp maybe? Right. So there are some crude measures, but I think there's room to grow in terms of some of the more scientific understanding of that. Yeah,
so it can be a challenging sort of notion, I guess, to assess, right? Performance, I suppose, can vary from one sport to a next, from one position to a next within a sport. There are probably appraisal things where the athlete has some sense of their beliefs about how they're performing relative maybe to how they performed prior to the injury. But also, you're alluding to maybe like functional movements, or, like maybe there's sort of biomechanics or kinesthetic kinds of indicators that look at maybe efficiency of movement pre, post, those kinds of things, I guess, or maybe even just, how many goals were you scoring before, or how many goals were you scoring after. So I guess it's a challenging area in terms of that third layer that you mentioned with assessment of performance.
To try and facilitate that within my own practice, what we do is within our return to sport criteria. Number one, the coach signs that they're happy for the player to both return to training and return to competition. So there's a coach involvement there who can bring that technical and tactical intuition they have about the player to the table when we make decisions, but also that there's a bespoke criteria within there, which is the coach is happy with the training form, because the last thing I would really want to do is a player to return back to sport not confident, and just be seen as a spare part, or that that limit their motivation, because suddenly they're trying their best, they're doing what they can, but they still are not at the level of all the other athletes. So I want players to return confident that they are going to be of use within that team setting.
Right. Earlier, Dale, you mentioned that one of your areas of research interest is this idea of readiness to return, and what that looks like, what it means, or what constitutes readiness. It's certainly an area of mutual interest. From your standpoint, what does it mean for athletes to be ready to return, and how do you know, or how do you gauge whether they're ready or not?
Oh, it's a major question there. So for me, when we start looking at some of the outcomes that research would lead us to believe, if somebody's not physically ready to return to sport, then that's quite easy. They're not robust enough to meet those physical demands. Physically, they're placed at risk, because returning to sport is dangerous. It's not predictable. And we can see actually how physically that can lead to some negative outcomes around underperforming and re-injury. So if I'm low in physical readiness, that's maybe what I can expect. And we've seen lots of athletes, haven't we, whether it be in US or UK sport, that are rushed back to sport really, really quickly, so quickly that physically they can't quite be ready. And it's often those athletes that become either your career rehabbers, or end up breaking down again. We're starting to understand that psychological readiness is equally as important, in terms of its relationship with the decision to return to sport, its relationship with returning to sport to the pre-injury level of performance. There's actually that association from a lovely paper by McPherson linking it with re-injury and associating psychological readiness with re-injury, and also some great work by Zarzicki and the Delaware group linking it with functional performance as well. So we know there are negative impacts if you're returning athletes when they are not psychologically ready. Now, we could plot that on a quadrants, couldn't we? And we could just go, okay, the only real great quadrant to be in maybe is that we return athletes back to sport when they are physically and psychologically ready. Now, your second part of the question was how do we know this? And that's really, really tricky. Physically, I think we've got some pretty well-established, reliable and valid tests. So we can put athletes on an isokinetic dynamometer. We can put them through some tests where we look at their aerobic capacity. We can look at a return to lactate thresholds. We can look at hop testing, although hop testing's come into some criticism of recent. So there's lots of tools to our armor, really. From a psychological point of view, psychological readiness, the tools are okay. There's tools that are there. And certainly the things like the ACL-RSI is an injury bespoke return to sport inventory that kind of is a proxy measure of psychological readiness. And the good thing about that is it's being used across other pathologies now instead of just ACL.
Right.
There's a more generic measure in terms of the Glaser work, the injury psychological readiness to return to sport scale. Again, it measures chiefly confidence, but confidence you're going to remain injury free and perform quite well. And there's other injury ones like the Cersei scale for shoulder injuries. What I would say is, and this is this is my own personal kind of synthesis from where the literature is. Within my return to play or return to sport criteria, I use a number of those scales as opposed to just relying on one.
Yeah.
I don't think that the research area is as mature yet to just go, this is a definitive scale. I'm happy that this one scale measures exactly what I want to measure. So I often take or triangulate from a number of different scales to make my decision around psychological readiness.
Right. Well, and I think, Dale, you raised an important point that there still seems to be uncertainty about what readiness is. And my sense in reviewing some of the literature in this area is that, maybe we're putting the cart before the horse, so to speak, because people are trying to measure a construct. They don't really fully understand what the construct is, right? Like where, you mentioned Glaser's scale that essentially equates confidence with readiness to return. Well, that may be part of it, but may not be the sum total of what it means to be psychologically ready. So to go out and then develop a measure focused specifically on confidence may not capture the breadth of what it means to be psychologically ready. Or, in the case of the ACL readiness scale by Kate Webster, that does have some different components to it, right? Like assessing emotions or your risk appraisal. Do you think you're going to get hurt? So I guess there isn't really consensus, I wouldn't say, on what it actually means to be psychologically ready. And it's, although increasing evidence is showing that however it's defined, that it seems to be predictive of some important outcomes, like whether the athlete gets re-injured or whether they're returning to their sport or not. So it seems like there's something there that's important, but we're still not quite sure maybe what it actually is.
Yeah, and it's only really recently that as a profession, we've really started to try to measure this thing or to take account of psychological readiness as being an important component of returning athletes to sport. So we've made some really good headway in terms of, hopefully, we're now measuring this and to inform our overall impressions of, should an athlete return to sport or not. But I think there's still some way to go in terms of how robust the instruments are that we use to measure it, which is, in an editorial about it, I spoke about using instruments, but not forgetting the fact you should use your own working knowledge of the athlete as well, which is normally gleaned from maybe, hundreds of hours of working with that athlete and lots of informal conversations you may have to form your impressions, as opposed to rely just on a single scale.
Yeah, well, I think that's a great point, right? Like maybe the question is how are these scales used, right? And if it is used as one piece of information that informs a conversation with, say, a physiotherapist and an athlete, rather than an exclusive piece of information that's relied on to make decisions, that's maybe more in line with the value of questionnaire or inventory. But also, I guess there's still probably a lot of uncertainty about what certain scores do in fact mean, right? So if like an athlete scores above a certain score or below it on any one of these questionnaires we've just been talking about, what does that mean in terms of their likelihood of getting re-injured or returning? And, you know, I suppose we're getting more studies to help us better understand what these scores may mean from an applied standpoint and how we should interpret them in practice.
Oh, 100%. You know, like you said, that there's one thing using a reliable and valid scale, but then there's another in terms of, in practice, well, what's a meaningful change
Right.
within these instruments? And,
Right.
you know, a paper that I read, which basically filled me with fear, was a review by Berge on, you know, what are the criteria that athletes get to return to sport. And Berge pretty much found out of about 215 papers, as a profession, we're still using time as our major criteria to return athletes to sport.
Mm-hmm.
Uh, and actually, I think in only one of the papers that he looked at with it that used criteria, in only one they had a psychological measure.
Right, right. So time, the point there being that time, like how long since they've been in their rehabilitation or recovery, and that's kind of used as the gauge to determine when the athlete should be returning. Is that
Yeah,
the
yeah,
conclusion?
and I think that might be another component of overall readiness. So overall readiness may well have this psychological, technical, tactical, physical, and biological element to it.
Right,
And so I think readiness is a really complex construct to maybe look at, but a really interesting one that can hopefully fuel lots of debate and lots of research and lots of good practice that across different sports. So, you know, how do they establish or measure or recognize readiness in their athletes?
right, right. Yeah, and you know, I suppose if we can get to the point where we have maybe a better understanding of what these different components that you were just referred to are in terms of, is the athlete ready, and that can help make better decisions about, you know, reducing injury, re-injury risk, or, you know, ensuring that, you know, the athlete returns happy and healthy and able to, you know, perform at a level that they're satisfied with it. Then I suppose it's, you know, the research is paying off in practice in that case. What are some of the things in your either experience as a clinician, as a researcher and scholar in the area of injury recovery that facilitate readiness to return? What are some factors, either specific to the athlete, the environment, that increase the likelihood that they might be ready to return?
Yeah. So there's a number of these. So number one is having realistic and clear expectations. Um, I think an athlete whose expectations have not been managed, uh, or because we're dealing with athletes that have quite a lot of stakeholders that are involved in their injury process, the expectations of everybody else haven't been managed. Is going to become disillusioned. They won't know what to expect. They may have unrealistic expectations of themselves upon return to sport. They may think, you know, they might be back performing how they were prior to injury and be impatient. They may think, you know, that they should be starting and finishing the whole of the 90 minutes, that they shouldn't be a substitute. So there's an expectation element to it without a shadow of doubt.
Right,
And that's really quite tricky to manage,
right,
because you've got to manage that with the athlete, and in my case, parents, but also coaches as
sure,
well.
sure. Do you see those expectations also not just in regards to their post injury or their return to sport after the injury, but that athletes have expectations about their rehabilitation, or sort of, you mentioned time earlier, that they have expectations about sort of their ability to progress through time, or to rehabilitate within a certain time frame? Are those
Yeah,
expectations apparent?
without a doubt. I think a player will always want to return to sport yesterday. They'll want it to be done it in as quick as time, and to a certain point of view, coaches want exactly the same thing. So it's quite often down to medical practitioners to be able to manage those expectations that everybody has, and that's really really tricky. And within my own practice, I'm just really keen that I manage that from day one. That we sit down from day one and we discuss the injury journey that we have at the regional talent club, and the fact that each stage of this injury journey is underpinned by you demonstrating certain abilities to be able to progress to the next element of that injury journey. So the athlete, the parent, the coach is really, really aware that it's not a case of, a time-based criteria that you're going to be rushed back. I will give you the best chance possible of returning to sport, but you must meet these different conditions.
Right. Right.
So I spend a lot of time with players when an injury's happened and maybe receiving treatment to explain that, so they understand that journey. And what's also important is that they understand the journey may not be a linear process. I think athletes expect that day on day they're just going to get better and better and better. And I often draw the lovely graph where the line just goes lovely diagonal, and that's what they expect. And then I draw another line which is a bit more messy, and it changes in direction and magnitude, and it's more dynamic. And I said, realistically, that's probably going to be more like your injury process.
Yeah.
The journey will be frustrating. We'll make slow progress. Sometimes we'll make quick progress. But please don't go into this thinking that you're going to have a lovely linear experience and it's going to be great, because you may suffer setbacks, and that's okay. What that does is that means that if they do suffer a bit of a setback, there's less of this idea of, oh, there must be something wrong. I've gone back to square one.
Right.
It hurts now. That must really be a really bad thing. We manage expectations like that quite a lot.
Right. And so it sounds like education and communication with the athlete plays a significant role in the work that you're doing to facilitate their recovery.
Yeah, it's probably the greatest gift that as a practitioner I can give. Believe it or not, with medical practitioners, we're starting to realize it's not what we do, it's how we do it. So, and by that I mean there are lots of different treatments we cannot give to people, and often the treatment specific effects are variable in the research. But what is really important in the research is contextual effects of treatment, and the context in which you deliver your treatments or your exercises is really, really important. So that quality of your interactions, the fact that an athlete has this sense of awareness of, why am I doing this? What options do I have? Have I had the opportunity to ask any questions about this? So we get that instant buy-in with the person. It's the basics of consent, isn't it? Understanding options, making choices, benefits, risks, and being able to ask questions. And I think as a group of practitioners, we probably could do better with that.
Right.
Ultimately, I want for each one of my athletes to understand, what's wrong with them. Why does it hurt? Why can't I move it? I want them to know why it was caused, or the probable reason why that was caused. I want them to know what that journey is going to be with the injury journey. I want to know, what are the conditions that they may well be progressed or they're going to return to sport with. But the other bit is they can understand that, what am I going to do, or what can I do to prevent this happening again?
Yeah.
because that's a serious concern for athletes.
Right. So I was just going to ask Dale, like when you provide those kinds of information about the nature of what's happened to them, or about sort of, expectations for the injury recovery journey, or you allude to, maybe helping them distinguish between different kinds of pain that they may be experiencing. What are the benefits, if any, of providing that information to the athlete?
Based on the athletes that I predominantly work with, which are anywhere kind of from 8 years old to 16-year-olds, it's really, really important, because number one is at that age that they're injured, that their knowledge and understanding, because they've got limited experience of injury, means they don't know anything about it. They can't really fully understand the processes that are going on. They don't understand the reasons or risks behind premature returning to sport. And in a way, that's a really tricky part for dealing with those players. Parents, some are good, some are quite challenging. But what I want to give them in terms of a gift is, if that happens again in their football career, that they're not back at the same place where they're catastrophizing the fact that they're injured. That actually they're a little bit more savvy. They have more knowledge and understanding. They know what sort of support they need, where to find that support. They've been empowered through the process that hopefully I've imparted with them.
Yeah.
Part of what I do with them for that, one method could be I just tell them, I tell them, this is what's happening in your body right now. This is the tissues that are injured. But again, I'm not sure that's in the athlete's best interest. So I give lots of things like injury homeworks, where the players, I sculpt a task, the players leave the session with me. They then bring their injury homework, and it forms a bit of a discussion and provides feedback for them. So they create that self-awareness. And right at the back of this, we talked about, they need to own that process. Players need to own their own process. And that's just one way in which I try to get the players to invest and own that process, really.
Right. So, when they have that knowledge and information, or, you alluded to things like giving them rationales and choices, and then that feeds in, or that fosters the ownership of the process, which, then sounds like it may translate into behavioral things, like how invested they are, how much energy they're putting into their rehab, or those kinds of things. So
I've done a little bit as well, where I've provided players with questions to go to their hospital appointments with.
Yeah.
And that was really born out of one player who had an osteochondral lesion. So she'd had a little fracture of a tibia. But that's all she'd been told by the consultant surgeon.
Right.
And I remember speaking to her and her mum after she'd had the MRI scan. And I said, okay, in your own words, can you tell me what's the matter with your knee?
Right.
And she went,
Yeah.
I don't know. It's just words to me. It's just language that I don't understand. And so I basically said, right, for each appointment you go to, can you please just ask these questions?
Right.
Yeah,
and that's
and they're just
great.
simple questions.
Right. Because, I guess, in that example, it's like, if you don't even understand what's happened to you, you're not going to have any idea what kinds of questions you should be asking. And so, when you equip them with that knowledge of, okay, here's the kinds of information that are important or useful to know, then again, hopefully that has some beneficial consequences. And it's like, okay, I see why I'm doing this, or I get the benefit of this exercise, and I understand what it's doing for me. They're more likely to be invested in doing it. Just on that note, what would you say are some skills, maybe, or attributes of athletes who seem to make an effective recovery, or however one defines effective or successful recovery?
Yeah. So for me, it comes down to expectations. That's number one. So they have clear expectations of themselves. that throughout the process, they've remained patient but optimistic.
Mhm.
The fact that they're able to rationalize, things will get better. It just might take a little bit of time. That's going to be important. And for me, within my setting, it's the athletes that keep engaged with their teammates.
Mhm.
Certainly the athletes I work with, that they sacrifice so much to be able to train, 3 times a week, and they play on a weekend, as well as being schoolgirls and balancing a social life. They need to be in around their teammates, and still have that identity that even though I'm injured, I'm still a valuable and well thought of member of this squad, which takes a little bit of kind of thinking about with how do I facilitate that with them. Things like, I'm really careful not to make my appointments with players at times where I would say there's peak socialization. So at the start, where they're in the changing rooms together, chatting about goodness knows what, but that's what I refer to as peak socialization. I would never then even dream about making an appointment with a player and their parents when I want them to embrace in that social experience and connectiveness with their teammates.
Right, right.
With that as well, naturally, they get extra connectiveness with their coach. And we know that the coach is a huge power figure in this idea of returning to sport. Will the coach think about me the same way? Am I still important to the coach who makes the decisions? And it just keeps that player in connection with the coach as well, which is also really important.
Yeah, yeah.
Uh,
Go ahead, sorry.
so for me, it's those things together. But you know, I have worked with players that you know I think you've talked about in one of your papers about physical and psychological readiness not occurring in the same time frame.
Right.
And I've worked with a number of players that probably years after they've been injured, I would not say that they were psychologically ready.
Yeah.
One player especially, we were playing away from home, and she was just going to make up an excuse why she couldn't play in the game. She was going to feign an excuse because we were going back to the ground where she ruptured her ACL.
Mhm.
And, luckily, I managed to chat with her before the game and mention a strategy that we were going to do. Me and her were going to specifically warm up in the blade of grass which you could remember, that she actually did that to prove that there could be positive outcomes to her returning to the scene of the crime.
Yeah.
But she was in complete emotional wreck leading up to that game.
Hmm. So, what are some of the challenges or fears, concerns that athletes have? I guess at any point in their injury or their recovery journey, as you put it. I like that
Yeah.
term.
So number one is when will I return? So there's a time based fear with that, and how many missed opportunities am I gonna lose out on?
Hmm.
Whether that be an international call up, a major international tournament, number of games. So there's that sort of fear. There's a fear of it happening again, and being seen as going back to square one. And like I've mentioned earlier, for some injuries, that sucks. There's things, for example, that happen too frequently, like graft failures in ACLs,
Hmm.
which means that athlete is effectively back to square one, needing surgical intervention. And that's a heartbreaking story for every single one of those athletes. And then there's an element of, well, will I ever be the same player? You know,
Yeah.
uh, will I ever get back to performing like I used to do? Will I be as fast? Is there going to ever be a time where I'm not going to think about this injury? Um, you know, and I'm a big believer that injury changes athletes. I don't think they ever learn to, to not think about it. I think that they just learn to cope with that and deal with that and rationalize things, or some of them certainly do. I always think about a couple of years ago, so I run, and a couple of years ago, I just fell over running. If you've seen my running gait, you'll understand probably why. I probably just clipped the pavement, but I fell over.
Move like a deer.
Yeah, and even to this day, every time I run past that exact space, I remember that's what happened. I probably subconsciously alter my running style and pace around there as well. And I think it's the same with a lot of sports injuries, that, players will compensate and learn to cope with that situation as opposed to forget about it.
Yeah. So, I mean, just a whole kind of host or set of kind of what if kinds of questions. And as you say, kind of learning how to try to manage these fears that maybe never entirely subside or go away altogether. I guess in terms of sort of managing those maybe fears or apprehensions, you allude to an example of a technique or strategy that you used with one particular athlete. Are there kind of strategies for helping athletes manage some of the maybe negative thoughts or emotions with their injury?
Yeah, I guess it comes down to, a lot of it is the relationship between the practitioner and the player. And that relationship really should be done pre-injury. I'm a big believer that your pre-injury relationship with the player will often determine how effective your injury relationship is. So that means that rather than just hiding away in a clinic room, that actually you're out there working with players before they're injured. So you have that meaningful interactions, that connectiveness with the players, so that when they are injured and there is heightened levels of stress, they recognize that they can come to you, they can be open, they can share their thoughts. I've often used peer mentors as well. So if players, because they're quite young, they often, again, inexperienced, if I can set them up with a peer mentor who's been injured, gone through that process, and I've even used international players for this, for some of our players, is there someone that they can talk to about that? Is there a mechanism by which they can talk about those negative emotions, and through talking about it, maybe rationalize that it's okay to feel like that. Obviously there's a step over, isn't there, to some, what we refer to in the medical professions as orange flags, where some of these normal negative emotions spill over into more clinical emotional disruption. Right. And it's about trying to recognize that and refer when those do present.
Sure. So, part of it, I guess, is maybe just legitimizing that it's perfectly understandable there are going to be some frustrations and maybe a whole set of emotions that go with an experience that, as you mentioned earlier, changes the athlete. So I also wanted to ask you, Dale, does injury change the athlete necessarily or inherently for the worse? In what ways does an injury change the athlete?
Ooh, so again, I'm from the belief that for an athlete, injury sucks. But that isn't me saying that injury is all doom and gloom for an athlete. I really do believe that if it's managed well, that injury is a really fantastic learning experience. And in a sense, that an athlete, maybe through being injured, it can be for their betterment. Whether that they work on something skills-wise, their understanding of the sport, whether that be they just understand their bodies better, whether that be it's allowed them to pursue other roles within that team. I do think that if you manage the injury process, it can have a positive outcome. And often when I've worked with, senior female players, it's about that idea of coming back stronger, and it allowing us time and to address opportunities to maybe plug the gaps of the reasons why you did get injured, for instance.
Right.
So, I've had some players who have talked about injury as an opportunity for reconnecting with their families and their partners, because they spend so many time either training or playing, that really spending time with family and partners, it has been limited. So
Yeah.
it's allowed them to plan their weddings or do some house renovations.
Yeah.
So or they've worked for the media, for example, because they're injured, and they've explored that as a potential career avenue. So I think there's lots of positives that can be made, but I think that almost needs to be managed for each athlete. I'm not sure that it comes naturally.
Sure. So, like, given the fact that injury can be an inherently negative or frustrating experience, that doesn't mitigate or eliminate the possibility that there can be positive outcomes or benefits to it. But I like your point, assuming that it's well managed.
Yes.
And so it's not that, I guess, one automatically derives benefits from an adversity challenge such as injury, but it's how maybe the athlete copes with it, the kinds of support they get that you've been talking about, the nature of the interaction between the patient and their primary practitioner or key others like the coaches and teammates. So I think that's just a superb point.
That sort of element of resilience that you were talking about there, and this idea of growth through adversity, or how do you make athletes more resilient, is by exposing them to adversity. I imagine that in some athletes that may be a process that goes that goes hand in hand, and it's a pretty hands-off approach. I think being proactive with that and trying to manage or provide a context that facilitates some opportunities or a learning experience through injury is probably a better way to work with athletes than presume that it just happens automatically. Yeah.
Right. And I know one of my former doctoral studies was looking at Paralympians and people who had significant and traumatic life-altering injuries, and one of the processes that was important in facilitating that idea of growth that you mentioned was having some deliberate reflection on their experience, and reflecting on their experiences in an intentional way and thinking about what they meant, how they might use that experience moving forward so that they weren't debilitated necessarily. Again, I think it's an important point, not just that you have the adversity or, like, what doesn't kill me makes me stronger. Well, not necessarily. It's only insofar as certain things are happening, how you're coping, how you're managing, what you're doing to maybe reflect, and some of those external support factors that may increase the chance that you're not debilitated, but that there's some form of growth.
Yeah, and I've chatted with quite a lot of players who've kept injury journals, and where they've been encouraged to write down their thoughts in a journal setting, but also track their own progress. What I tend to do is I use the return to sport criteria on the journey themselves, so they can actually see how they're getting better and stronger throughout that process. So they can reflect on the journey a little bit more with that.
Right, and I guess also within that, reflecting on their competence or increased competence as they're gaining in skills physically and maybe and otherwise. I just wanted to touch on one or two other things. I appreciate your wealth of knowledge, again, Dale, both, from the scholarly standpoint, but also practically, and your work with high performance athletes. In terms of, we talked a little bit about pain management, and I'm wondering if there are tools or strategies that you use to help athletes with pain. And I suppose like pain could be maybe physical, psychological.
Yeah. Other than some appropriate analgesics, I think it's a powerful message to send to players that pain does not equal pathology. And we're starting to understand that a little bit more in the realm of chronic lower back pain.
Mm-hmm.
That often for players, a major inhibitor in their progress and willingness to engage in some activities is pain. And it's reframing what pain is and what pain isn't. So for me, that's a big important message that I send. Pain's not good or bad. It doesn't equal pathology. So if you get a bit of discomfort, it doesn't mean that that's anything massively significant. Things might feel different because you've not moved it very much over the last month or so. And often what I do around that is I will often use pain threshold when I'm working with athletes. So I will say, for example, anything up to 3 out of 10 on a pain scale is okay. Because if we send out a message to every player that everything's got to be pain-free, they probably wouldn't get out of bed on a morning. Right. So that's a real important message. Anything above a 3, then we need to rethink about what we're doing, the intensity of it, the movement. But actually, it's okay to feel a bit uncomfortable. And that's a really, really important message, an empowering message to send out to people, because, we're programmed naturally to go, pain's a bad thing. Pain's a bad thing. How do I stop this hurting? I know, I'll just not do anything.
Right.
So that's a really empowering message that I think, and that there's some fantastic work by the David Opar, Ryan Timmins, Jack Hickey group around pain threshold rehabilitation versus pain-free rehabilitation. Right. And lo and behold, working within a pain threshold leads to a quicker return to sport, but also leads to better outcomes upon return to sport as well.
Yeah. So it sounds like you're making distinctions for athletes about what's benign pain or harmless, what's more sinister or harmful forms of pain, and also just letting them know or reinforcing the idea that there is pain as part of the rehabilitation process. If you have swelling and you go in the ice bath, it's not going to feel comfortable, but that pain is important to maybe work through in the healing process. Or maybe you're doing an exercise that's uncomfortable, but that doesn't necessarily mean you're doing further damage. That's part and parcel of the recovery process. So how do you then help athletes disentangle pain which is benign from pain which is more sinister or harmful?
Part of it is the threshold that I use.
Right.
And so the threshold that I use, which is that 3 out of 10, helps me and them distinguish when should I be worried, when should I be concerned, when pain might not be benign. It may be, I'm provoking an irritable structure, for example. So it's mostly when I'm guiding them with and educating them around that pain threshold that we start separating that out. What we know with certain chronic pathologies is the way that the brain interprets pain is different. So with certain chronic pathologies, tendinopathies can lead to this, especially, and fasciopathies, where the more chronic an injury gets, the brain starts interpreting pain in a different way, and starts seeing movements that shouldn't hurt as and interpreting that as painful. So with chronic injuries, there is that psychological element to pain that is really difficult to untangle with athletes, because, like I said before, we're just led to believe that pain is a bad thing, and if it hurts, that's a really negative thing on the body, and everything needs to be pain free.
Right.
And untangling that with an athlete, and trying to think about, well, how can I get them to view their pain in a slightly different way is really, really tricky, and it needs educating, it needs patience, it needs you showing them some brilliant infographics that are out there on certain pathologies like lower back pain. So we're having to almost get them to think about reinterpreting what pain is, what pain isn't, so that we're not using that as a reason why they can't move.
Sure. And I would imagine maybe in the case of high performance athletes, that reinterpretation isn't too far of a stretch because they're used to experiencing pain, right? Like they know that maybe when they're doing the 100-meter sprint, or they're doing a full out effort, there's pain involved, but it's not necessarily hurting them, and it's in fact helping them maybe gain greater fitness or
Yeah.
exceed their current capacities in some ways. So my last question, Dale, is if you can offer, or if you were to share a piece of advice for injured athletes, what would it be?
The biggest bit of advice I would offer, and I've said it a few times of this, you need to own the experience. And to own the experience, you need to be educated. You need to seek information, but you need to realize that you need to be central to the process, and you need to drive the process. And in that regard, hopefully you'll come out of that with an increased self of awareness. You'll feel in control of the decisions that are made because you're fully informed of what the choices are and the benefits and the risk. But ultimately, you are driving the bus, and hopefully you've got a really good set of passengers or social support network that you can rely on to help you as you drive that injury journey forwards.
Yeah, those are great words to finish our conversation. So I want to again say thank you so much. It's a pleasure speaking with you, Dale, as always.
Very welcome.